Hello everyone, welcome to Yashoda Hospitals online segment Know Your Doctor session. Just when it seems that the COVID-19 scenario is settling down, we get to hear about a new viral disease, that is tomato flu, which has crept its way into Kerala. So let's discuss about tomato flu and various other queries. I'm Dr. Lakshmi and today we have with us Dr. Suresh Kumar, consultant pediatrician from Yashoda Hospitals, Somajiguda. Welcome, doctor.
Hello.
So doctor, what exactly do we mean by tomato flu?
This tomato flu or tomato fever as it is called, basically it looks like a viral fever. As of now, we do not know exactly what causes, whether it is bacterial or viral. It is pretty early to know or pretty early to comment. As of now, lot of children have been reported to have this kind of illness in Kerala and some parts of Tamil Nadu, and similarly Karnataka is on high alert. It looks like a viral illness where children are shown to have some red rashes which look like tomato or shine like tomato. That's why the name.
So what are the general symptoms that one should look out for, or when should one seek medical help for this?
Commonly reported symptoms so far are like fever, body aches, headache and rashes. There are a lot of other symptoms like bowel upset, like vomiting, loose stools, pain abdomen and all, but the most common symptoms are, like I mentioned, fever, headache, body aches and rashes. These rashes are very peculiar. We used to see this kind of rashes in other diseases like hand, foot, mouth diseases in the past, where children used to have these rashes over the palms, soles and mouth. But this particular fever causes rashes even on the trunk, that is on the body, and they look very red, bright red, shiny, resembling tomato. It's not the size of the tomato, but the look of the rashes are like a tomato. That's why it's called tomato fever.
So you've just mentioned that the rashes, they resemble tomatoes. So how is it spread? Has it got to do anything with tomatoes?
It's just a misnomer. It has got nothing to do with tomatoes. It spreads like most other viral fevers through droplet infections. It might not be contagious, but it's better to be safe and then isolate from ourselves if we find any child with a tomato fever. So it's like any other viral fever, spreads through droplet infections.
So doctor, tell us one thing, is tomato flu a new viral disease just like COVID, what we have seen in the past?
I don't think so. It looks more like a hand, foot, mouth disease, a new variant of it, and this disease, what I am calling hand, foot, mouth disease, has been existent for centuries together, and this could be a variant. When it was first reported, they were not very sure whether it was due to something related to the food, or whether a bacterial or a viral, or they were even considering it to be an after effect of other diseases like chikungunya or dengue. But as of now, it looks like viral, the way it's spreading and affecting the people in close contact. So probably it's just another viral disease which we don't have to worry to an extent of COVID, because there is not significant mortality which has been reported. Having said that, it's better to be cautious rather than feeling sorry later.
So doctor, talking about preventive measures, what are the steps that one should follow to prevent this disease, and does masking help just like what we have seen in COVID?
So COVID has taught us one good lesson, that is prevention is better than cure, the age old saying. So it's better to be safe. Coming to the prevention part, if you find someone who is unwell, better to avoid close contact with them. And second thing, following cough etiquette, which most of us have learned during COVID, that is, do not cough into your palms. If somebody wants to sneeze or cough, better to sneeze or cough into the elbow, and frequent hand washing, avoid unnecessary shake hands. So mask definitely is going to help to an extent, but I would not say that you need to wear a mask just to prevent tomato fever. Other preventive measures are also required. And well hydration is another important point. Like if somebody is unwell, keep them well hydrated so that they will not go into dehydration, which has been reported in few children with tomato fever so far. So these are the common precautions which I would mention.
So talking about supportive measures, if a child develops fever, how should the parents take care of them at home?
Consult your pediatrician if any of the danger signs are there. I'm going to mention the danger signs. The common symptoms, like I said, are fever, body ache, headache and rashes, which can mimic any other viral illness. If the child continues to be febrile despite paracetamol or the regular treatment for the routine viral fevers, consult your pediatrician. If your child is not passing adequate urine or seems to be having altered sensorium or seems to have persistent headache despite paracetamol, consult your pediatrician. The therapy includes paracetamol, well hydration, and then keeping away from the other children. This should be adequate. In addition, good bed rest and avoid unnecessary exertion.
So doctor, apart from tomato flu, what we have seen in Kerala and other states, what are the other general conditions that one should be aware of, especially in children in this season?
A lot of viral exanthems can occur, which have been there pre-COVID era as well, like chickenpox, which is a common seasonal illness which we see during summers. And then we have seen rise in other exanthems like measles kind of picture, because a lot of them have missed their routine vaccination during COVID era. And then we can see some other illnesses like dengue. Once the monsoon starts, we are going to see the rise in dengue. So some of them will have similar picture. To talk about dengue, it can present with fever, headache, body ache and red rashes. They might be different from the tomato fever, but this is a common illness which can spread through mosquito bite. And chickenpox is another common illness which can occur with fever, which can be low grade, and subsequently they can develop rashes all over the body. Some of them are self-limiting and some children can develop complications due to chickenpox as well.
So doctor, what are the vaccines that children can take to prevent certain diseases?
The conventional vaccines, as I would call, that is, which are there in national immunization schedule, like MMR, will definitely prevent significant number of children getting measles, mumps and rubella. And some other vaccines which are not covered in national immunization schedule but are there as a part of Indian Academy of Pediatrics, like Varicella Vaccine, which is given from the age of 15 months. This can be given very safely to all children above the age of 15 months, and it prevents nearly 80 to 90% of cases. And then even if somebody develops this disease despite getting vaccinated, they will have milder symptoms and lesser complications.
So doctor, before ending this episode, what message you would like to give as far as preventive measures are concerned for viral diseases in children, especially in this season?
Appropriate vaccination, good balanced diet and physical exercise. Do not forget exercise, because COVID has taught us that nutrition is an important and essential part to take care of our health, but do not forget exercise as well. So at least about 60 to 90 minutes of physical activity in addition to balanced diet, which should include fruits and vegetables as well, and then well hydration and appropriate clothing for the season.
So thank you doctor for this informative session. It was wonderful talking to you.
Thank you.
So this brings us to the end of this episode. We've been discussing about tomato flu and various other concerns around this topic with Dr. Suresh Kumar. Do join us for the next week as well. Thank you and stay safe.